on with our student recognition portion. Michael.
Hi, everyone. As I read your name, if you would come up, maybe kind of to this side of Chris.
I'll guide you up here for a picture is what will happen.
Right. So we'll begin with Shu Chen. Shu conducted fieldwork in Singapore and completed a thesis titled Incremental Cost-Effectiveness Analysis of QFT Test in Uveitis Patients for Tuberculosis Screening. She was mentored by Eric Finkelstein. Katherine Culver. Katherine conducted fieldwork in Haiti and completed a thesis titled Improving Health and Well-Being of Orphaned Youth, Introducing Yoga at Children's Homes in Haiti. She was mentored by David Boyd. Christina Diedrichson. Chrissy conducted fieldwork in Moshi, Tanzania, and completed a thesis titled Evaluating the Impact of Peer-Led Drama as a Tool for Pedestrian Education in Tanzania. She was mentored by Kearsley Stewart. Bethany Deprete. Bethany conducted fieldwork in Kolkata, India, and completed a thesis titled The Relationship Between HIV Risk Behaviors and Stigma Among Men Who Have Sex with Men in Kolkata, India. She was mentored by Regine Prochot-Bell. Ashleyeisenberg. Ashley earned a Juris Doctor from the Duke Law School and a Master's of Science in Global Health, and completed a thesis titled Assessment of the Success of Two Patent Pools for Global Health, the Medicines Patent Pool and the WIPO Research. Elsa Freeze. Elsa conducted fieldwork in Eldoret, Kenya, and completed a thesis titled Chronic Interpersonal Trauma in Kenyan Adolescents, a Comparative Model. She was mentored by Eve Puffer. Alexis Gaines. Alexis conducted fieldwork in Brazil and in Durham, North Carolina, and completed a thesis titled Health Disparities and Prostate Cancer. Can educational status, race, and distance to care facilities impact risk on initial biopsy? She was mentored by Catherine Hoyle. Joanne Gaushan. Gaushan conducted fieldwork in Singapore and completed a thesis titled The Association Between Work Productivity and Physical Activity Among Singapore Full-Time Employees. He was mentored by Eric Finkelstein. Ross Hansen. Ross conducted fieldwork near Iquitos, Peru, and completed a thesis titled Influence of Roadway Development and Rainfall on Malaria Entomological Inoculation Rates in the Peruvian Amazon. He was mentored by Bill Pan. Mirna Hosdik-Munn. Mirna conducted fieldwork in Sri Lanka and completed a thesis titled Exploring the Health of Sri Lankan Female Domestic Workers, Returnees from the Middle East. She was mentored by Truls Ashtaby. Weishi Zhang. Weishi conducted fieldwork in Singapore and completed a thesis titled Exploring Singaporean Physicians' Perceptions of Their Roles in Palliative Care Through Best-Worst Scaling Analysis. She was mentored by Eric Finkelstein. Nan Jen. Nan conducted fieldwork in China and completed a thesis titled The Effect of Health Policy on the Access to Medicine of Patients with Chronic Diseases in Hangzhou and Baoji. She was mentored by Xinglan Tang. Amo Karnik. Amo conducted fieldwork in Kenya and completed a thesis titled Design and Usability Testing of Mobile Phone-Based Patient Management System for Women in Rural Kenya. He was mentored by Eric Green. Stephen Kimani. Steve conducted fieldwork in Cape Town, South Africa, and completed a thesis titled Feasibility of Respondent-Driven Sampling Among Methamphetamine Users in Cape Town, South Africa. He was mentored by Christina Mead. Paul Park. Paul conducted fieldwork in Kenya and completed a thesis titled Assessing the Accuracy of a Point-of-Care Analyzer for Hyperlipidemia in Western Kenya. He was mentored by Gerald Bloomfield. Joanne Philogene. Joanne conducted fieldwork in Haiti and completed a thesis titled Patterns of HIV Serostatus Disclosure and Sexual Risk Behaviors Among HIV Youth in Haiti. She was mentored by Melissa Locke. Sylvia Kravenek Sable. Sylvia conducted fieldwork in Kenya and completed a thesis titled Accuracy of 24-Hour Dietary Recall in Children ages 8 to 13 in Western Kenya. She was mentored by Sarah Benjamin Nealon. Paige Scholler. Paige conducted fieldwork in Ghana and completed a thesis titled Assessment of the Cocoa Farmers' Knowledge, Attitude, and Practice of Buruli Ulcer Disease. She was mentored by Dennis Clements. Benjamin Silverberg. Ben conducted fieldwork in Guatemala and completed a thesis titled Overcoming Barriers to Pediatric Surgical Care in Guatemala, Stories and Surgical Systems. He was mentored by Henry Rice. Elizabeth Tant. Elizabeth conducted fieldwork in Brunei and completed a thesis titled Equity and Access to Healthcare in Brunei Dar es Salaam. Results from the Brunei Dar es Salaam Health System Survey. She was mentored by Xinglan Tang. Anna Urhara. Anna conducted fieldwork in Sri Lanka and completed a thesis titled The Effects of Spatial and Temporal Differences in Dengue Virus Spread for Southern Sri Lanka. She was mentored by Christopher Woods. Junyong Wong. June conducted fieldwork in Singapore and completed a thesis titled Barriers to Cervical and Breast Cancer Screening Among Older Singaporean Women. She was mentored by Eric Finkelstein. Congratulations to all of you. We're truly impressed with the quality and diversity of your research and fieldwork and thrilled to count you among the growing alumni population.
Okay, we're moving along. So, it's now time for the Outstanding Student Award, which is given each year in recognition of the Master of Science in Global Health student who has excelled in the classroom, in the field, and as a community builder here at Duke. Choosing the recipient of this award is always a challenge, and this year was no different. But one student rose to the top of the list. Stephen Kamani exhibited his passion See the enthusiasm? His passion and dedication to global health since arriving at Duke in August of 2012. He has impressed his mentors with his maturity, dedication, desire to learn, and humility. And he is a leader among his peers. As a research assistant on an NIH-funded study on methamphetamine and HIV risk in Cape Town, Steve was fully involved in every aspect of the study, from its initial preparation for implementation of the study to data analysis and manuscript writing. In his first year, he made high-quality contributions to the design of data collection instruments, the development of the study protocol, facilitation and translation of all study instruments, and the consent form into 2 local languages, as well as data management. Steve's work in the field drew commendation from his peers, and his mentors credit him with the successful and easy launch of the study and the establishment of clear and logical procedures in the field that were invaluable for the duration of the project. Not only is Steve an outstanding student and stellar member of the research team, he has contributed enthusiastically and frequently to the Masters of Science program by participating in the recruitment for the Durham and DKU programs, authoring blog entries, and providing thoughtful feedback always. In short, Steve exemplifies the ideals of the MSc-GH program, and we wish him all the best as he moves into his next phase of his career. Steve, please come up and accept your award. Okay, so officially that concludes our program for this morning. Thank you for joining us, and we hope you will enjoy the remainder of commencement weekend and the formal Duke ceremony this Sunday. Enjoy dessert, coffee. We'll gather and enjoy each other's company. All students are requested for a 1 p.m., say we have about 20 minutes, 1 p.m. group photo, and I'm supposed to gesture towards the door. That door, under the tent, okay. And please also let us know how to stay in touch with you. There is a small card in the folio that you received where you can indicate your email address. Please leave it with us before you leave, and know that we are interested in watching and celebrating your progress in the future. Now, my hope for you is that you never stop asking those challenging questions, whether your next step is directly involved in research, in medicine, in program delivery. You never know where the good question can lead you or inspire the work of others. So congratulations again. Thank you.
To learn more about the Duke Master of Science in Global Health, visit globalhealth.duke.edu/MSc-GH.